Good afternoon. My name is Carl Cooper. I'm the Director of Public Health Programs at the American Association on Health and Disability, and we're so thankful you could join us for our Facebook Live series that we're starting this week on getting the most out of your health insurance. We have a very exciting guest that we want to talk to today about getting the most out of your insurance as it relates to rehabilitation and habilitation benefits. This is going to be a series we're going to be running over the next couple weeks. That's going to be on Wednesday afternoons. So we'd ask you to join us in future sessions, as well as we'll be dealing with some issues like mental health, medical devices, prescription drugs, access to specialists, and some of those kind of topics and other related issues that people with disabilities face when they're trying to get the most out of their health insurance. But with that, we want to go ahead and get started with today's interview. And today we have Chase Bearden, who's going to join us and talk about his experience specifically of accessing coverage as it relates to rehabilitation and habilitation benefits. So Chase, welcome to our live stream today. And if you would, just tell us a little bit about yourself, who you are, where you're from, and as much as you want about your disability.
Yeah, thanks, Carl. I appreciate it. My name again, Chase Bearden. I'm the Deputy Executive Director for the Coalition of Texans with Disabilities. We're a statewide advocacy organization here in Texas. Most of the work we do is at the Capitol. We work kind of on the bigger policy side, not one-on-one with people, trying to help, the day-to-day. I have an insurance problem. What do I do? We try and take the bigger umbrella view of it and take all the issues people are having and make the changes at a policy level. Which gets difficult, I think, for many in the disability community. Texas, we struggle here. Mainly, we have a lack. Well, we shouldn't have a lack of funding, but we do. So when you look at a lot of our Medicaid programs, our waiver programs, they are definitely not as strong as what you would see in other states. Lucky enough, I have private insurance through the group I work with. They actually view that as one of the big benefits of our organization. And it proves that even a small org with a majority of people with disabilities under the current law can get pretty decent health care, and not be given such a high price that we couldn't afford it. So we've put a lot of focus on trying to keep people healthy, making sure people are able to go and get what they need when they need it so that they can work. That's kind of the best way. You keep people in school, you keep people at home. That's a good healthcare program. But yeah, we've had our issues. For me, I broke my neck as a gymnast when I was 17. Spent, a good few years going through rehab, kind of working my way out of there, and ended up helping run an adaptive sports program for years. That program ended up shutting down, and I ended up a new job, and I found a home here at CTD and been here ever since for about the last 15 years. So during that period, though, I went from having no insurance and trying to go to school to a period where the only thing that was available was a high risk option that Texas offered at the time. But the cost of it was it was exorbitant. I mean, it would have been my whole paycheck for the month, and then didn't cover anything really. So when we had healthcare changes in the law, and I got private insurance here, it really changed my quality of life and my access to healthcare. And I think that's something we've worked on for quite a while here, but it's not the only thing. We work on basically anything that has to do with access. So our mission is making sure people can live in the community where they feel they want to be. And if it's access to education, if it's access to cannabis, to transportation, to medications, prescriptions, that's where we put all of our focus in, is access and making sure people get it when they need it.
Okay, that's great. And so when you said you had private insurance, is that through your employer then, or on the marketplace?
Yeah, it's actually through our employer. We had the discussion this year for the first time of if we should give everyone basically a stipend to go purchase theirs in the public sector on their own. And when we looked at things, we couldn't. Well, it was so hard to navigate and understand, but we couldn't find as good of a deal for as broad of a coverage. So we stuck with in the private world here. But we did make a change. The last 12 years, we've been with Blue Cross Blue Shield, but they were raising the rates every year. It's kind of like that thing where you stay with the same phone carrier for too long, you don't get the special deals everyone else is getting. We also found that last year, they not only raised our deductible, but they removed our prescription plans. And then we had to pay for all up front till you cleared your deductible before you even got any prescription plan coverage. Now, it was a wake-up call because, my wife has one medication that she takes. It's $2,000 each month. And of course, that's not the price that gets paid, but through the negotiations and everything, we weren't told that Blue Cross was going to make that change until she went to fill her medication in the new year. And lo and behold, all of a sudden we have to pay $2,000 this month and then another $1,000 the next month till we hit the deductible. And so that was kind of a shock. We just weren't ready for it at the time. We ended up having to have her apply through one of the manufacturers to get a discount just because we hadn't set aside enough during the middle of COVID, and she had reduced hours from where she was working. So it was kind of a real kick. This year we just changed because they resubmitted our information and they raised the prices even more and they raised our deductibles even higher, but we ended up with less coming out of it. So we made the change to United Healthcare, and we're having to navigate that now. I've been in their program for 8 days and I finally got a card yesterday.
Oh, wow.
So now we have to, you get used to navigating one system, even if it's a bad system. Now we got to learn to navigate this new system. So yeah, I've been lucky though. I mean, I really do think having that private insurance, being able to go see the specialist when I need to, without having to go see first my primary care doctor, then go see the specialist or go see the PT before seeing a doctor. That's one less trip, one less time I have to take off work. So that really does help. Not something everyone gets that option if they're in an HMO or a different type of health plan.
Okay. And by the way, I would encourage those people that are joining us live, if you do have comments or questions, feel free to put them in the comments and we can get any questions that people might have. So with that understanding then, Chase, what are the main things you rely on your health insurance for?
So for me, it's, definitely waiting for, when you live with a disability, you always know there's going to be something big happen in the next few years. There's never a 10-year period where you don't go without having to visit a hospital or, an ER. And for me, the last one was I broke my leg right at the start of COVID. I ended up with a spiral fracture in my femur. And, I got immediate care and I got the best care. At the time, I got one of the better surgeries. And when I talked to the doctor and he's like, if you'd have been in some of those other plans, they wouldn't have done this surgery. You would have had to basically try to heal it without the rod. So that was, kind of eye-opening. I figured they would go with what's the best for that patient, but I guess there is some that plays into it with what kind of insurance you have. So, at the end of that, I spent a month in rehab. After that, you're looking at almost a $300,000 bill. So that it saved me. It's what got me what I needed at the right time. The other parts of it is just prescriptions. I mean, I think after almost 30 years in a chair, your body has, you end up having to have certain requirements. You have to stay on them. And then whenever, PT and OT, there's just certain times every few years where I need to go in and get some work done. And, so I rely on that. Urologicals, dealing with, those needing to get in. Because I think sometimes for many people with disabilities, they'll try and put something off if they can't afford to go in. I think that's one of the big things is I don't have to wait, so I can address it sooner. So that's been a big plus. And I think it's kept me healthier. But it shouldn't be that way. It should be that everyone has access when they need it, not having to wait because of the program you're in doesn't pay, but a handful of specialists that give up their time every now and then. I've had friends who it took 3 months, 4 months for them to get into a specialist. Well, when you're dealing with some of these issues, you really do need to get in faster than that,
Mm-hmm.
especially when you call their phone number and it says if you have severe tingling in your feet and your hands from a nerve issue in your neck, call us and we will get you in today. Um, but depending on the program you're in, it may be 3 months before you get in.
Mm-hmm.
So, there's a big difference in some of these programs.
Yeah, so you mentioned early on that you had quite a bit of rehab early on after your injury. Do you want to talk a little bit about that and how important that was to your health?
Yeah, when I got injured, they still actually kept you in the rehab for a while. I got 3.5 months of inpatient,
Mm.
which was I needed that at that time. At C5-6, I wasn't actually moving anything below that. I had torn all the ligaments in my neck from the way I'd hit, so I needed to recover some, even just from that, before I could really dig into that therapy of being sent. Going from 17 and able to do anything to all of a sudden not being able to take care of myself at all at that point. There was a lot to learn, and 3.5 months wasn't really enough time,
Mhm.
but I was lucky enough to get a year's worth of outpatient afterwards. And that's kind of that golden year of you really learn a lot that first year, and that's all those splinter skills are what you take home and that you're going to use to determine all your independence in the future. So it's vital up front to get that care and get it in a good chunk, um, and to continually try and get in and get new therapy, because you can learn new techniques. And the more active you are, the more you can do for yourself, um, the more cost return you'll have. You'll be able to do more longer for a longer period of your own life and not have to be as independent or dependent on others, but that also affects your health.
Mhm.
So, getting the right care, making sure you seek good qualified, physical therapists or OTs or doctors that actually understand your injury, that have worked with spinal cord injuries before. I think that is it's something you got to research in the process, and it's something that will make a big difference in the amount you bring back home with you afterwards. But yeah, I got to think that the more involved you can be in with any adaptive sports or any kind of continual physical therapy of some sort, it's in the long run going to pay dividends to you.
So, and you mentioned you were also doing you have physical. You still go through physical therapy now?
I actually had just finished up a big round of it. So because of COVID, most of them had shut down. I hadn't been able to go in. Um, and, after having that broken leg for that long, I still needed to work some things out. Is if my leg wouldn't bend as much as it needed to, it took away some of my independence with getting dressed and transferring. So I did. I went in and I spent about a month and a half at the end of this beginning of this or end of this last year, um, and was going in 3 days a week, and it really changed. I mean, it made some big outcomes for me, not just in my leg, but just in my overall strength, which kind of got me back going so I could do the things I needed to do. I hadn't realized how much I had lost um, during COVID,
Mhm.
and just from laying around trying to let that leg heal. It definitely goes faster than you gain it back.
Mhm.
So yeah, it made a big difference. Now for our insurance plan, then I had to pay out first. We
Mhm.
only get 30 visits, and we have to pay that out first till we hit our deductible, and then they picked up the rest. Um, if I'd have realized that, I might have waited until the beginning of the next year to start
Mhm.
that therapy, so I wouldn't have to pay and burn through. I could have done more. So that was kind of one of those things I should have looked at a little closer on scheduling and trying to get the maximum out of it that I could out of that plan year. But you live and learn.
Yeah, that's a great pointer, for people that are going through this. That if you are coming up at the end of a year, maybe if it's something you can wait on, and you haven't met your deductible for this year, wait until the next plan year and have it go against that deductible, because you might need you might need other services next year then that will already be offset by what you paid early on. Where do you think you'd be if you weren't able to get access to the physical therapy?
If I wouldn't have gotten what I got at the very beginning, I definitely don't think I'd be working a full-time job. I don't think I'd have made it through school. I think I would have probably ended up the original doctor I had, who said basically you're probably going to live at home and have your parents take care of you the rest of your life. He probably would have been more accurate. Lucky for me, he was older and he didn't understand that things have changed, and independence. Some people aren't just going to stay and do what they say. So I got good therapy and I was able to learn a lot. And I really do credit that to the adaptive sports and seeing other people with disabilities, how they did things. Because you get so much from therapy, from PT and OT. But when you start watching other paras and quads and kids with CP and, MS running around doing their own thing and getting in and out of their chairs, you start finding different ways to do things. And I think between the two, definitely it set me on a trajectory to succeed more than I would have. So it's invaluable. I think it's something we should, as a country, really focus on helping people have access to more. Because even when I started dealing with pain over the years, you can only go so many years after breaking your neck and, using only a handful of muscle groups to do everything that everyone else does, that your body's not going to have a lot of pain. So basically what they did is they started me on painkillers. And by the end of that, they were giving me 180 hydrocodone a month for $10. And that was the first round treatment for pain or anything. When what they should have done was actually invest in therapy and send me to PT. And we could have probably fixed a lot of the issues that were causing the pain and never had to put me on those. And that way I wouldn't have to work my way off of them. But instead, first round treatment was drugs.
Yeah. It's unfortunate that lots of times that is the default of a lot of providers. And I certainly can relate to the comment you made about, so many times providers think they know what your, and doctors specifically, think they know what your outcome and what your life is going to look like. I know when I was born, my parents were told that I would never walk. And I do have mobility disabilities, but I am able to at least walk some. And it goes to show that providers do not understand what the individual human can overcome. And so great reminder on that.
So true.
In terms of, you already talked a little bit about some of the issues you've had with copays and deductibles and the like. Any other barriers you've had to using your insurance and getting access to providers or networks or anything like that you've experienced?
I think sometimes too, it's within your network may only have a few choices, and the doctors in that choice may not be as good as another doctor. You run into it. There's some that specialize. They know a lot about spinal cord injuries. They know a lot about, this or that, but they may not understand someone who has CP as well. Really trying to find the right doctor and find that right fit and do whatever you can to stick with them. I know even here, we've started having discussions with our HR at the end of each year. Basically, like, we're a small group. There's only 12 of us within our office, but we try and find out what are the main needs of everyone. What is it? Is there a specialty medication you're getting? We're very open here about talking about it. Of course, you have as much privacy as you want, but if you're receiving services for your child, or certain doctors I go to, that if they change the plan, I would literally pay cash because they're so good. It's not worth me trying to go to another doctor. So we spend time actually trying to make sure everyone, if we make a change, will still have the coverage they need. So, that's always something, a suggestion, no matter where you're at, have that discussion with your HR, or, when they start looking at plans, saying, hey, are there things out there that we could do to make the plan better? Or, where are you willing to give a little to get more over here? I think it's learning how to understand, and it's complex, but understand what plans you have and what you're going to get, and
Yeah.
then how to use them.
Yeah, and I was going to say, and then I also think about people that are on the marketplace, and looking at networks is so important because you're right. So many times, those of us that have disabilities, we find a provider we really like, and sometimes if you have to pay a little extra to get on a plan that's going to have that provider and network, that's worth it sometimes
Yeah,
to pay a little extra a month to have access to that provider you
yeah,
can trust. So
exactly.
I think that's really important to keep in mind. As we wrap up, are there any other tips or tricks that you've had over the years that you think that would be helpful to folks listening in that maybe are looking at insurance and trying to get the most out of their health insurance that they already do have?
The one thing, use the customer service line as much as you can.
Hmm.
Just because one says no or something, always challenge it. If they deny you, don't be afraid to challenge it. Talk to your doctor, see if they'll write, that justification, and ask if you can participate in writing that justification. I know in my last wheelchair, me and the PT sat down. I helped her write the actual justifications for some of the parts we wanted. We won some, we lost some. I just still kind of crack up that they don't cover side guards or a better back, or if you want the front caster wheels that are a little bigger because your sidewalks in your city are terrible, that they won't cover those. They look at it as, well, we're giving you a chair to roll around in your house in.
Hmm.
You got to remind them that we don't live in our houses, we live in the community. you
Hmm.
know it may take a while for you to get the equipment you need, but you can fight for it and you can argue for it. Sometimes you don't have time to wait, and you gotta buy it yourself to add on. But if you can start early, process is always going to take a while, and just stick to your guns and don't stop calling.
Hmm. Great pointers. And I want to thank you for joining us today, Chase. It's been a real informative conversation we've had, and I think people that are listening are going to get a lot from some of the things that you've learned over the years. And we want to thank you for joining us today.
Thanks, Carl.
Yep. So that concludes today's presentation. I want to welcome you to join us next week. Next week, we're going to be having a conversation on mental health. It will be a couple hours earlier because of when our interview subject is available. She's available at 1 p.m. Eastern. So join us 1 p.m. Eastern next week as we talk about getting the most out of your health insurance coverage as it relates to the mental health field. So thank you very much. And we wish the best of luck as you're using your health insurance.